Let's talk tendons and treatment. High loads or low loads? That is the question. So we've seen research supporting high loads for tendinopathy management, and then there's also research that suggests that high loads are not in fact needed for functional improvement. Now, functional improvement can be measured differently, and there is definitely some nuance here. Are we talking about subjective functional improvement, less pain, able to participate in day-to-day tasks? But what about recurrence rates and more long-term type outcome measures? So, sure, someone may feel better in the short term, but if the issue tends to come back, is there a better approach? So, low loading protocols have been supported in the tendon research for years. So, classically, like many of you may have known, the Alfredson protocol, which uses low intensity body weight exercises with a high daily exercise volume. Now, there's a little caveat to this. So, body weight may be super light relative to someone who maybe is an athlete or, maybe has a stronger baseline of functional strength, but it also could be very heavy to someone who is more deconditioned. But let's kind of take it for face value here. If we're doing body weight exercises, we're pretty much going to be on the lower end of the loading scales here. So the Alfredson protocol can be seen as a low load, high frequency, high intensity program. So we're seeing some improvements with this. And in fact, there's actually a study from Radanovic and colleagues in 2023 that compared high loading group to a low loading group using the Alfredson protocol. And they found that there was no significant difference in pain measures between the high load and the low load group, and both groups improved in pain and function. So what's the scoop here? Let's do some housekeeping first and go over some definitions. So this is what I was talking about. Do we really need changes in tendon properties to feel better? And as some studies suggest, we might not. So to kind of dive in a little bit more to that research, that study I was talking about, the high load group, when they compared the high load to the low load group, the high load group had improvements in tendon stiffness, which is a good thing. It sounds like a bad thing. It's a good thing. And we'll talk about what that means in a second, and decreased tendon strain. And they also had maximum volitional contraction improvements. So they had improved health markers of the tendon, right? So positive tendon adaptations were taking place. So I would argue that, or maybe you would argue as well, that this could be better for long-term tendon health and possibly reduce the risk of recurrence. The low loading group, or the Alfredson protocol, didn't see these tendon changes per se, but both groups got better, right? So something's going on here. But like I said, let's dive in a little bit to what we're looking at when we talk about tendon strain, tendon stiffness, and definitions like that. Also, too, we also see some research showing that blood flow restriction training can be very beneficial for tendinopathies, and blood flow restriction training does use relatively low loads. So there's something going on here that we don't necessarily need high loads to feel better per se, but let's take a little bit of a closer look here. So tendons respond to high loads, and this is something that is basically consistent across the research here. If we want to make positive physiological tendon changes, right, at the cellular level and the functional level, as far as physical level, I should say, where the tendon can handle more load, they have to be exposed to a high load training protocol. So load occurs through strain, like tendon load can be defined through tendon strain, right? So if we have no strain, we have no gain. That is our stimulus for tendon adaptation. So strain, what is strain? So tendon strain is basically the relative change of a length of a tendon compared to its original length. So strain in a tendon occurs when the muscle pulls on that tendon, right? So let's take a tendon, for example, let's take the patellar tendon, for example. If we do an ultrasound and we measure the resting length of that tendon, that is going to be our resting length. And then if we put the quadriceps under significant load, you're going to have the quads pulling on the patellar tendon, which is going to cause a relative length change, right? So basically the difference between the loading and the resting length is going to give you your strain value. So an increase in force and or stretch, right? So we can also increase tendon strain by stretching the tendon or stretching the muscle. If we stick with the patellar tendon, As we move into deeper ranges of knee flexion, we're going to get more strain on the tendon as well as if we were to increase loading on a particular exercise. So we can have an increase in force and or an increase in stretch that will increase strain on the tendon. And like I said before, strain is that stimulus for physiological adaptation. So basically what happens in a nutshell is the stretching of the extracellular matrix components and collagen fibrils during loading allows for cell-to-cell communication and a coordinated response required for intracellular signaling and upregulation of proteins that potentially promote tendon adaptation. So strain sounds like it's a good thing, but obviously too much of a good thing is not a good thing, right? So too much strain can be obviously not a good thing. And the ideal zone seems to be from 4.5 to 6.5% strain to give you those enough of strain to cause adaptation, but not too much strain where we're exceeding the tendon's capacity to handle load to any significant degree. So greater than 8% strain may lead to tissue injury or failure at higher strain rates, right? So a ridiculous example here, but that gets the point across, is picture jumping off a building, right? If you jumped off a building and the second you hit the ground, that is a ton of force that is going through your tendons. So the likelihood of a patellar tendon or an Achilles tendon rupture would be high because the strain value is super high and it's ridiculously exceeding the capacity of that tendon to handle load. But we can also think of this cumulatively, right? So cumulative strain is also important as well. And this is where a lot of tendinopathy issues arise because we have someone maybe who's playing sports and they're doing a lot of jumping, cutting, pivoting, say basketball or soccer, for example, and they haven't done much of that activity prior to the season. Now they're getting into the season and they just ramped up their activity. So cumulatively, all that stress on the tendon or all that strain being put on the tendon is exceeding that tendon's current capacity, right? So strain can be cumulative. It's important to note that, but it also can be acute strain as well. So training improves resistance to strain and creates a quote unquote stiffer tendon, right? So a stiffer tendon is not a bad thing because in athletics, a stiffer tendon is more resistant to length changes at a given load. So if you take someone who is a high level athlete and they go to do a vertical jump, right? And let's say they're running and they do a running vertical jump, their tendon is not going to give as much, right? As they go to apply that force to the ground and spring up. So they're going to have a stiffer tendon, which gives them a stiffer spring, which is going to allow them to transmit forces better and jump higher. Versus someone who's sedentary, if they were to do the same task, or if they were to take a quick running start and try to jump vertically, saying to touch like a basketball rim per se, their tendon won't be as stiff. So as they go to apply that force, you're going to have more of a length change or more of a strain in the tendon relative to that same activity. So they're not going to be able to get as high. The forces will not be transmitted across the tendon as well. So having a stiffer spring is advantageous for athletics. And this is improved through training where we have strain values that are causing physiological adaptations. So how much strain do we need and how do we gauge this? So there is some literature that points to 70% of a 1 rep maximum is kind of like that lower level threshold to start causing tendon changes. So this is pretty high on the loading scale. And I will point out in a second that this is not really the end all be all here, but 70% is kind of like our entry level here. So let's take a look at why this may not be totally accurate in every single person here. So I do have a graph obviously here that's going to point out two different athletes, right? So this is flawed a little bit. The 1 rep maximum is flawed a little bit. And this is why. So you can look at strain in two ways, right? So you can have higher loading with less of a stretch position, let's say 80% 1 rep max. You can have lower loading, let's say 60% of a 1 rep max at longer lengths, but both have been shown to increase tendon adaptation. So kind of getting into a little bit of an issue here if we're just using 70% as the end all be all here, right? So we have to take into consideration not only the loading on the tendon but also the range that we're working it through, because as we said before, tendon strain can increase through loading, but it can also increase through length changes or like being in more of a stretched position here. Um, but tendon properties matter. So if we take the example looking at this chart, if we take someone who has poor muscle strength, but a relatively stiff tendon, so stiff being a good thing, like we said, for athleticism, you may not get sufficient tendon strain working at 70% one rep max. Conversely, one may be able to strain the tendon to a higher magnitude if the individual has good muscle strength, but a more compliant tendon, a tendon that's not as stiff and can't handle, uh, loading as well, which may facilitate adaptations at slightly lower intensities, such as 70% MVIC. So, think of the first example here. You have an athlete who maybe hasn't done a lot of strength training in their career, but they are super elastic. They're springy. They can run fast. They can jump high, and they can handle their body weight well, right? So they may need higher loading to get those strain values that are above 70% to really get those adaptations that we need to see in the tendon, right? So conversely, if we talk about the other example, if we take someone maybe who's a primarily strength trained athlete, they don't do a lot of jumping, pivoting, cutting, sprinting. They might have really strong muscles, but their tendons are a little bit more compliant. So this might be someone who like goes to the gym often, but never really does plyometric type stuff. They might get tendon adaptations at a lower percent of one rep max because their tendon, will say here, quote unquote, is the weak link compared to their muscle tissue. So the 70% one rep max is a little bit nuanced, but we can use that as a nice baseline and basically see how our patients are responding to the dosage that we provide them. And as we can see here, kind of circling back, do we really need high load in tendinopathy treatment to start feeling better? So as you can see in this chart here, at week 1, we're going to see if we start an exercise program for a tendinopathy at week 1, you're going to see primarily central nervous system changes resulting in increases in muscle function. So the muscles are already starting to function better, and you might already start feeling better acutely, right? So we have things where people come in for therapy, they start doing their exercise program, and in a week they're like, I already start feeling a little bit better. So do we really make any significant tendon changes in this time period? Probably not, but we have other factors at play here. At 12 weeks, we start to see changes in the musculature. So hypertrophy, increase in fascicle length, pennation angles, right? Things we see from resistance training. And we start to see subtle tendon structure changes and improvements in tendon mechanical properties. So that's a big window here. So at the 12-week mark, we're starting to see if the dosage is correct and they're handling their program well, we start to see changes in tendon properties. So if people start feeling better at 4 weeks, 5 weeks, 6 weeks, and they're like, I don't need to come to therapy anymore, I feel great, did we really make tendon changes? Physiologically, I would argue maybe there are some, but I don't know if it's going to be enough to really warrant that was the specific cause of them feeling better. So we have this little interplay here where, we can start feeling better, have improvements in pain, have improvements in function, but we didn't make a whole lot of changes to the tendon. And as we see, tendons take a long time to adapt. So 6 months or even greater, then we start to really see those appreciable improvements in tendon structure that are going to be observed at this stage. So tendon changes do take a while. So usually especially for my athletes, we always stress the importance of, hey, once you're done with me in therapy, you have to continue loading, and it's going to be beneficial to maintain strength, but also to continue to build strength and resiliency in your tendons to make sure this doesn't come back. So here's my argument for high load training. High loads, as we just saw, promote positive physiological adaptations. You have improved tolerance to loading, and we can possibly, and this is a little speculation, possibly see a reduction in future reoccurrence of tendon issues, right? So that is my argument here for high load training. With low load training, sure, we may see some good improvements in pain, self-reported function earlier on, but are we really getting these positive adaptations that are occurring at the tendon level? Probably not. So I think high loads may have a better place if you can work up to those. So, in a nutshell, that is my argument here on tendon treatments for high load versus low load. But I do want to touch a little bit on programming. So, let's talk a little bit about programming here and kind of circling back to how do we structure a loading program to promote these tendon adaptations. So, as we talked about, intensity matters. We're going to work up to an intensity of loading that makes those physiological tendon adaptations. So, as we pointed out, we need at least 70% of their MVC, and this is going to vary, but it's going to get you in the ballpark. So, body weight may be a good place to start, but usually won't be enough to drive those adaptations. So, pain will play a role here. If someone is very irritable, we may not be able to load them heavy enough right off the bat. So this is where we're going to, work into our isometric hold. So isometrics may work well for pain relief. There's some mixed evidence here, but isometrics can help with pain relief and they may help to improve tensile strength of the tendon. So a good rule of thumb here is 5 sets of 30 to 45 seconds have been shown in the research, has shown some promise, but there's not a one size fits all approach. So isometrics may be a great place to start, especially if you're dealing with someone who has a more irritable tendon issue. How about heavy isotonics? So we're going to work up to really hard sets of 4 to 6 reps for whether it's Achilles for your calf strengthening, whether it's knee extensions for your patellar tendon or quad tendonitis, but we have to work up to hard sets of 4 to 6 reps because that's where you're going to get a high enough loading threshold to create the stimulus for those tendon adaptations. So this will ensure that heavy load is being used because if you're struggling at reps 4 to 6, that's a pretty heavy weight relative to what you can handle. If isotonics are provocative, then I would always suggest using controlled tempos. So performing strength work at a cadence of 60 beats per minute may help manage symptoms. So if someone's having, let's say they're on the knee extension machine because they have patellar tendinopathy and they're having pain when they're doing isotonics, set a metronome to 60 beats per minute and follow that as their cadence through their exercise, and you might see an improvement in pain levels and their ability to tolerate that activity. So managing tempos for an irritable tendon does seem to work pretty well. How about pain? So pain guideline here for your lower extremity tendinopathies, we're looking at like a 4 out of 10 or less is okay during exercise. So this may not be a pain-free process, and that's okay, but we do have to educate our patients that this may not be completely pain-free. So I usually give a working guideline of like a 4 out of 10 during exercise is acceptable, and then we go from there. But we also have to consider our soreness rules. So soreness rules, and this is super important because this is how tendons typically behave, right? So usually they're irritated as you start activity, and then they have this warm-up like effect where once you start moving, and like, all right, tendon pain went away or it got a lot better. But then when you stop the activity, and usually within the next 24 hours is when you have this increase in tendon stiffness and pain. And I'm talking not about physiological stiffness, but like perception, like my tendon feels tight, sore, painful, right? So tendons need to be monitored over a 24-hour period after an exercise intervention. So soreness rules is critical. So if there is an increase in their baseline pain within a 24-hour period of your intervention, I always suggest to scale back because we don't want the tendon issue to get worse the next day. So that's super important. The first thing I would do is to scale back the volume. So tendinopathies don't always need a ton of volume, especially early. So I always suggest to keep the sets heavy. So keep the intensity high, but just reduce the number of sets that you're doing. And that might be enough to help with any, if you're having issues the day following, if the patient's reporting an increase in symptoms the following day. Intersession rest intervals are also important. So tendon recovery does take time between exercise bouts. So ideally, you want to provide them a 48-hour window of recovery between high intensity loading days. That's going to give the tendon and your body enough time to help, recover between high loading bouts. So 48 hours is a nice window and something that if you can structure your program that way, try to shoot for at least 48 hours between loading days. And then we want, like we saw on the chart, we want at least 12 weeks of strength training, and it may take 6 months or greater for full symptom resolution. So this is a bit of a marathon. Changes can definitely happen earlier, but if someone who's dealing with recurring tendon issues, you want to make sure that they are on the same page and they understand that, hey, listen, once you're done with me, you may be needing to, continue this strengthening program for, honestly, as I always say, for the duration of their athletic career, because why not? Strength training does help many facets, but for tendon issues, you want to make sure that you're carrying this out for at least a 6-month period to get those long lasting changes to prevent any sort of reoccurrence. So that is my spiel on high load versus low load tendons. And thanks for watching. If you have any comments, please reach out to me. If you have any questions, please reach out. More than happy to discuss.